Warning, this content may be disturbing to some audiences. Subscribe, if you dare. There was a girl who thought she is supposed to take birth control tablets only on the day she has sex. Hey everybody, welcome to ANECDOSED. People ask Reddit. Doctors of Reddit. What's the stupidest patient you've ever had? Number 1. There was a 24-year-old patient who was brought in from a jail in a rural county. He was working roadside cleanup when he found a bottle in a ditch that he thought contained alcohol, and he quickly chugged it down. To be fair, it did look like whiskey. It wasn't. It turns out it was a substance that contained sulfuric acid. Its pH was less than 2.5, it just ate up the litmus paper. So shortly after he gets to the ICU, he is in excruciating pain and vomiting blood. The gastroenterologist took him to do an EGD, basically a procedure where they can look at the esophagus, stomach and duodenum with a camera attached to a flexible tube, and the pictures were horrendous. You could literally see his stomach and esophageal mucosa eroding away. He had to be sent off to another hospital where they had an esophageal surgeon who could repair the mess. He of course needed multiple surgeries and had a very long hospital stay. I saw him a few months later when he was admitted for another issue. He was down to 90 pounds, from about 150, and was getting fed through a peg tube. He was very lucky to be young and otherwise healthy, but obviously not very smart. Number 2. Patient who was recently diagnosed with diabetes. We needed to adjust her blood sugar levels, but she kept eating sweets. So we had to talk for like 30 minutes with her about not eating sweets and so on. She seemed to understand. 5 minutes after the conversation, she went around drinking a soda. Another guy who had a benign arrhythmia, the heart beats irregularly. He knew that he could get the arrhythmia from time to time, but as long as he didn't faint or got any pain in the chest, he could just take a beta blocker and let it pass. But he went to the ER like 6 to 7 times before he understood that we couldn't do anything. One patient came in for something, can't remember what, and when we ran the test we found that he had a pH of 6.97. That is on the border of what the body can have and still have any function at all. He should be dead. But he was awake and clear. We wanted to admit him to the ICU and adjust it with utmost care. But he needed to go home. To eat a shrimp sandwich. Yes, a shrimp sandwich. We sat down and talked to him and his mother for 30 minutes that no shrimp sandwich in the world is worth your life, and if there is something else you need to get help with, we can help him. But nope, he left. He came back a couple of hours later and we cured his acidosis. But that must have been a mean shrimp sandwich. Number 3. I had a patient come in one day and tell me they were struggling to swallow their medication. On closer inspection, it turned out he was trying to swallow a suppository. Had another patient come in who had recently been diagnosed with asthma to tell me she was finding her new Ventolin inhaler to be ineffective. I asked her how often she was using it and she said every few hours. Naturally, I got her to show me in case her technique was wrong. Lo and behold, she shakes the inhaler, takes off the cap, proceeds to lift up her shirt and spray onto her chest. Number 4. Saw a young woman in the emergency department. Her primary complaint, per the triage nurse's note, was lethargy, but she was awake and alert when I went to see her. I told her that she didn't look lethargic, and most patients who are lethargic come by ambulance rather than walking into the ED, so I was wondering what she meant. She started to tell me, well, last night while I was sleeping, and I interrupted her because, of course, people are a bit lethargic when they are sleeping. But I caught myself, and asked her to continue. She then tells me this story. So last night when I was sleeping, I was talking in my sleep. People have always told me that I talk in my sleep, my family roommates, you know. So anyway, I was talking in my sleep, and I was saying, Mary, that's my roommate's name, Mary, wake me up. And it was really hard for her to rouse me from sleep. And that's why you're here today. Number 5. ER nurse rather than doc, and it's hard to fathom the stupid that we see. Woman came in for an upset stomach. Had been prescribed antibiotics recently for a UTI and decided to take them 4x per day instead of 2x because she thought it would work quicker. More chest pains caused by meth or weed that I can count. Someone called 911 and had an ambulance bring her in because her implant-on birth control was hurting her arm. I pain after welding without a mask. Guy had just gotten a kitten and it scratched him. Showed me 2 cuts less than 1 centimeter long and not even broken the skin. Teenage girl came in by ambulance for flu symptoms. She said she tried to go to urgent care but it was closed, so she had to call 911. More mothers requesting drug screens and pregnancy tests for their daughters than I can count. Effing full-grown adults requesting pregnancy tests because the ones at the store aren't good enough. Hint, they're exactly the same as ours. Woman and came in for abdominal pain. Didn't think she was pregnant but reported not having her period in 8 months. You could feel the outline of the effing baby on her stomach. Delivered 2 or so weeks later. Drug seekers came in with a newfound allergy to non-narcotic pain medicine. Stated they made him go anaphylactic. Had been in the ER 5 days prior without the allergy. Drug-seeking mother using her 11-year-old daughter to try to get narcotics. Upset with us because we didn't give her daughter opioids for a bruised shin. More parents bringing their less than 6-month-old babies in for crying or spitting up milk a couple of times than I can count. Unknown rash on skin for 6 months. Had seen his PCP and even a dermatologist without improvement. Guess he thought our ER providers were bigger experts on skin issues than dermatologists. Woman who came in because she squirted during orgasm and had never had that happen before. Drug seeker who was upset that he got Vicodin instead of Perctens as he called them. When he told his wife, she exclaimed, "Didn't you tell him that you used to take Perctens?" People coming in for abscesses on their arms which just happen to be near veins and calling them spider bites. People are so stoned that you have to shake them to get them to open their eyes, getting upset because you're not giving them narcotics for their 12/10 pain. It just never ends. Number 6. I had a patient who was paralyzed from a low back problem that was reversible by surgery. The night before surgery, his blood glucose was getting up pretty high, like 500-ish and climbing. I told him we had to start an insulin drip to control it. Wound healing and infection risk are greatly affected, and no surgeon would do this surgery with BG this high. He then drops this line, "It is against my religion." Okay, in fairness, I get religious issues all the time, so I try to be a good doctor and ask. He states he is Catholic. It took me a effing hour of my life at 3 a.m. to get him to take his insulin. He was ever due close to spending another day without use of his legs because he made up a religious objection to insulin. I can't fathom the stupidity that had to be conjured in order to roll that dude. Number 7. I used to be a pharmacy technician. We had a patient who thought he was only supposed to use Lantus pen, insulin, once and throw it away. When it was time for the next injection, he used a brand new one. He was always bitching that we only give him 10 pens and it lasts him 5 days. Thousands of dollars wasted by this idiot, and yet insurance agreed to override early fill rejection. There was a girl who thought she is supposed to take birth control tablets only on the day she has sex. Number 8. I'm an ICU nurse, but this exchange happened to me when I was helping the ER triage a 40-something-year-old patient. Me, do you have any medical history? Them, no, I'm pretty healthy. Me, I see you take metoprolol. What do you take that for? Them, high blood pressure. Me, so you have high blood pressure? Them, no, because I take my pill. Me. So what would happen if you stopped taking your metoprolol? Them, looks at me like I'm an idiot, my blood pressure would go up. Me, nods, so you have high blood pressure. What other medical history do you have? You'd be surprised how many people think that their daily home medications cure them so that they no longer have any medical problems. Number 9. Had a young woman come in just recently with a sinus infection. After telling her as such and offering a script for Augmentin, she demands to be tested for HIV. Basically, she was concerned because she's had 2 colds this winter, and that's unusual for her. So, she put her symptoms into Dr. Google, who promptly told her she might be immunocompromised and have HIV. No amount of reassurance convinced her, so after much crying on her part, I ran an HIV test, which was shockingly negative. Edit, bonus story on my ER rotation, and had a young woman come in with abdominal pain. Asked if there was a chance she was pregnant, which she denies. Me, are you on birth control? Her, no. Me, and why are you sure you aren't pregnant? Her, because of him, indicates a 3 to 4-year-old playing on a phone. Me, you do realize it's possible to have more than one, right? Came back after obtaining a urine pregnancy test to tell her she's preggo. She's unconvinced, so we do a transvaginal ultrasound and point out the nugget in her uterus. She starts crying and going on about how mad her baby daddy was going to be. Number 10. In medical school at a urology service clinic, I'm sent in to see a 20-something-year-old man whose complaint is that there is something wrong with his testicles. He is in a gown sitting on a table, and I take a history where he tells me one of his testicles is bigger than the other and has been that way for months, and he wants them to be the same size. I have him stand and lift his gown, and his right testicle is about the size of a grapefruit while his left is normal size. He looks at me and says, "See, they are not equal. I want the left to be big like the right." Unfortunately, the right one had cancer in it and it had spread. Number 11. A 63-year-old gentleman with coronary artery disease, all cabbed up, DM, dyslipidemia, HTN came into the cardiology clinic for a follow-up. His LDL, the bad cholesterol, is through the roof. With so many comorbidities, we would like to keep it very low, as he had already had a major myocardial infarction. So, we asked him about his medications, and he has of course stopped taking his statin because the lady on the television, who is a famous figure in our country, said that they were bad for you and that they were a plot by Big Pharma. She also apparently told him to eat 0 carbs and lots of fat, and he had bouts of hypoglycemia because his medication was not adjusted for it. So after spending almost half an hour convincing him that statins were okay aside from their actual adverse effects, we sent him on his merry way to endocrinology. That was a rather frustrating experience. The worst thing is the TV lady is actually a professor of cardiology who turned into a TV personality, medical quack, dietitian after discovering that there was money to be made. Make sure to share your personal story in the comments below and have the opportunity to be featured in a future video. Also, if you like these topics, don't forget to like, subscribe, and hit the notification button to continue seeing more content like this every day. See you next time.